Hello, healthcare. We're really excited for all of the people who are lining up to have this conversation. I know it's been a little bit of a while since we've done a Hello Healthcare on LinkedIn, but if you haven't been following what we've been doing, we've been posting a lot of videos, podcasts, and things like that out there. The podcast is available anywhere that you listen to podcasts, Spotify, Apple, what have you. Oh, 1 second. I know it's been a little bit of a while. Doubling up on my voice. I apologize about that, y'all. But anyway, yeah, feel free to access any of these types of conversations on YouTube. We just like to keep it open for you. Really excited about the conversation today because this is an opportunity with Minerva to elevate a lot of the conversation that we see around AI. The reason that we're focused on how AI can be addressed to focus on equity challenges is because like typically the conversation around AI is like, hey, how do we build the best recommender system to get you your favorite TikTok videos or recommend content like this in your news feed. But there's a lot of applications, a lot of thinking about addressing problems with social inequity and social justice. You might have seen us focus on that in some webinars and video things that we've done in the past. But Minerva Tantoko has dedicated her career. Like if you can go on her LinkedIn, you can look at some of the past, and you see a theme of walking on the line between technology and equity. And she's done that in a lot of ways. Currently, she's the chief AI officer over at the NYU McSilver's Institute. But we're looking here at a world-class leader in terms of city development. I'll brag on you. You don't have to brag. I'll brag on you. But as New York City's first chief technology officer, helped New York City attain the distinction of the best smart city in the world. Built a bank from scratch and currently built a digital bank from scratch and currently working on a book around equity and AI and addressing those challenges. So Minerva, I just wanted to give you an opportunity to say hello and just share a little bit of your background, your thoughts, and why you're here.
Thank you so much, Chris. It's an incredible thrill and honor to be here. And, one thing I will mention is I have been involved in AI since the mid 80s. I started my first AI company in 1985 while I was still in college, and that was a decision support system for corporate strategists. And since then, used a lot of technology in the private sector and wrote 4 patents in mortgage process management and using some AI principles. And so one of the things that I hope to leave folks with, both as practitioners, meaning the people creating the AI, but also, even more importantly, the users of AI, to think about the ethical impact of what they're doing. And so, it's one of the reasons I love talking with folks in particularly in the healthcare space, because, while IT has been incredible in making healthcare more efficient and, digitized healthcare and personalized healthcare, I think we also want to make sure that we're always putting a lens of, equity against, the tools that we're using, and making sure that we haven't, for example, automated the wrong things or having a disparate impact, unintentional perhaps, on those that we're using our technology on.
Well, Minerva, I have to say that you picked the right audience. Like when you want people to think about the ethical implications of AI, a lot of the people that we speak with are motivated healthcare leaders. I've had conversations with like a lot of our audience about their own ethical issues in data and algorithms, and this is the group of people that I think are going to be interested in, hey, what are the technical decisions we should be making? What are the underpinnings behind it? How do we drive organizational change? But overall, how do we think about the ethics behind that change that we're driving? Also wanted to give a shout out to Janae Sharp. Thank you. And for anybody who has anything to share, thoughts, comments, questions, stories, let us know. Drop it in the comments below. We're happy to have this discussion with you. So Minerva, just like with your background, public service and entrepreneurship, like that combination of things really stands out. Could you talk about just, I mean, your personal background and some of the problems you're focused on tackling right now?
Sure. I think, as I mentioned, I've had 3 startups. I'm definitely a technology optimist, a person who really thinks about how technology can help. And that has driven my over 35-year career in technology. The big eye-opening experience I had was when I became the first CTO of the city of New York and really understood how technology impacts the day-to-day lives of residents here in New York, how you can actually use technology not just to make things cheaper or more efficient or more accurate, but actually can help change people's lives, make their lives easier. And then this sort of tech for good became the next phase of my career, and I think more and more technologists should come into public service, city government, federal government or nonprofits, because your skills are going to help make the world a better place. And so, I think the other aspect of it is this entrepreneurial style that I've always had in my career, even in very large entities, big global banks and things. I think this entrepreneurial sense is really about problem solving and having more tools in your tool belt to solve the problems that you see. And so if you say, well, there's health inequity is a problem, or teen suicide among Black and brown youth is a problem, then you can entrepreneurially think, oh, what would be some great ways to approach that problem using the tools that we have today. And as we were talking about earlier, how could I use the algorithms that predict which TikTok videos you're going to like, or that you want to buy a new pair of purple socks, because you bought a pair last week, and actually use those same algorithms to promote a positive message, or to educate people about mental health, or how to, actually discern where there may be differences in the right kinds of interventions depending on your income level. So really it's that combination of a long career in tech and, this passion for public service, I think is really catching on. I see many more folks really thinking about, having meaningful careers and doing things that help others.
The way that you framed up the concept of tech for good, like I'm really eager to get into like what kinds of interventions that you're focused on with these algorithms, what you're able to do. But if you think about the overarching like concept of tech for good, I like the fact that you're making a call for people to come in and get involved. Because there's a lot of people, honestly, they're friends of mine who have maybe been in healthcare data science or been in healthcare AI before, and change industries and are reluctant to go back because they hear about the like various things that are perpetuating bias. They hear about these problems with algorithms, but to see that there are people that are focused, like making a very specific, intentional effort to develop programs or develop in a way that addresses these biases, that's attractive to a lot of the core talent or future career paths that might be missing from it.
Mm-hmm. Absolutely. Well, let me step out of healthcare for a little bit, just to sort of give you an idea what some of the thinking was. So, what struck me during the pandemic was that based on your tax return, you might get a check in the mail, right? So we kind of knew ahead of time that you might need some extra cash, right? Based on your income, that we already had that data in the government, and that money went to you, right? That might have seemed like a sort of a crazy idea a few years back, but during the pandemic, it was an absolute, you know, um, help to those who really needed it. So what if you apply the same thing to housing? What if we knew that, you were having trouble paying your rent? Well, instead of making you apply and fill out, hundreds of pages of forms to get rental assistance, what if we already knew that and said, hey, here's how you can get rental assistance? Wouldn't that reduce the people getting evicted, right? And so if you kind of think about this sort of preventive kind of approach to something like eviction, you could absolutely think about that kind of approach, that preventative approach and proactive intervention approach to all manner of healthcare kinds of issues. And so, that's one of the things that we're thinking about in terms of suicide risk prevention at McSilver, which is if there is data that shows that if you're in this demographic and have this particular attributes, or have this many times you've been sent home from school, or whatever data that we would gather, say from a child welfare, what if we could then proactively intervene and propose counseling, right? Instead of expelling the child from school, what if instead we said this child needs counseling, and offer that as assistance? And so, just that framework of saying, not only can your predictive analytics show who's at higher risk, but then also use that data to test whether certain interventions are more effective than others, and save lives, which is what we all want to do in healthcare. The other is, if we actually know that certain kinds of systems have underserved a particular group of people, how could you then use algorithms to say, well, what can we do to change that, right? And how could we, in the mortgage industry, for example, there's a company that what they do is they de-bias algorithms. If it shows that it is providing, biased results, they're able to show that their sort of hostile AI can actually say, well, if you actually change some of the parameters, say like credit score adjustments and things like that, you actually are less biased in the results for giving credit scores. So, what other ways can we use the very technology that we're using today and actually improve its accuracy, and improve its predictive power, and show that you can have much better outcomes as a result?
Well, a big component about what you just mentioned was, okay, so let's say that like we're looking at a risk score, in a lot of cases AI is just putting out a percent, a probability, a risk score. So we're looking at a risk score for various behavioral issues or attendance issues in school. And you switch the context around it. What if we're like, rather than looking at ways to make excuses to punish, like what if we look at interventions that solve the problem in the first place? There's actually a parallel I want to draw in healthcare, which is, and often there's the issue of things like appointment no shows, cancellation risk, the concept that people schedule an appointment and it's extremely costly if they consistently aren't showing up to the appointments that they're scheduling. So it like you'll hear some organizations that want to do no-show modeling as a means of, okay, well, we want to like make sure we're incurring financial penalties or double booking or different things that disincentivize the no-show. But there's deeper thinking in a lot of those cases, that perhaps there's issues around transportation and access and like the ability to even arrive at the appointment in the first place. So like that's an example where the algorithm to make the prediction is the same, like predicting a no-show, but what are we doing? What are we thinking about the decisions around like what we do once we identify that somebody has a high risk of no-show, or in the case that you brought up, like high risk of not showing up to class or what have you.
Right, exactly. I think that's to me, you see that a lot in the algorithms where the approach is punitive versus proactive, is what I would say. Right. So so baked into that, well, we're just going to charge you, or we're going to fine you for missing it. That's a punitive response to the risk, as opposed to, well, what if we did these other things? Would that impact, how often you actually came to the appointments, right? And what, as you said, it may be transportation, or it might be, work related. It should be, earlier in the day or after a work day or whatever it is, right? And we have the tools and the data that could actually um, help with the more proactive intervention that would prevent the missed appointments. Because the assumption is that if you find people, then they're going to show up, but that's not necessarily true.
And I got a question that from Sergey that I want to address. But Sergey, before that, I was wondering, Minerva, if you could just talk about the NYU McSilver Institute and their overall focus.
Yeah, I'd love to. Hold on, let me pull it up here. So the AI Hub at McSilver, it's the McSilver Institute for Poverty Policy and Research. So we really are taking a two-pronged approach. And the AI Hub was established to investigate specifically this: how can AI systems be used to equitably address poverty and the challenges relating to race and public health, and to provide thought leadership on those implications. And so that is our mission. Couldn't think of a better one for what, for me. It literally is an institute. It was funded by the Silvers, who very much believe that the tools of AI can be used to help fight, the effects of poverty, and specifically in public health. It's part of the School of Social Work, and so so it's focused a lot in those areas. And so where a big part of AI research is really its intent, right? And I think that's our intent is to both reduce the harms of the misuse of algorithms, or that unqualified use of algorithms, and at the same time actually use AI in a positive, proactive way.
So I love the focus on intent there too, because that's kind of what we were just talking about. Are we looking for punitive intervention, or are we looking for ways to help and address the root cause?
Mm-hmm.
To get into Sergey's question, I love the question, which is for companies in digital health, are there principles or rules of thumb or any kinds of resources to get to an ethical, like an ethical guideline in machine learning? Like what are the resources and rules of thumb to get to where you're trying to go there?
Yeah, I mean, I think there isn't a clear guide. It's one of the reasons I'm focused on writing a book called Ethical AI: A Practitioner's Guide. Part of it is to say, there are some things to think about upfront. Question one: what are you optimizing for? Right. So if you're optimizing, say, for reduced cost, interrogate the results to say, but what has gone up as a result? And so in other cases, maybe you may be unintentionally optimizing for the wrong thing or a counterproductive thing. So if you want to reduce missed appointments, right, maybe you can, but what has gone up? Maybe people just stop coming. I don't know, and so I think it's sort of to think holistically about the algorithm and what you're optimizing for. I think the second thing is, what data are you using, right? How was it gathered? Was it aggregate data that may not reveal the insights that you're looking for, the results that you're looking for? And so oftentimes aggregated data, depending on how you're training your system, may mask, big differences between, geographic location, distance from the doctor's office, or the income level, or if we transportation, or things like that. And so, try to think, beyond the computation to the actual real world results. I often talk to people about, I don't know if this may have happened to a lot of people, but it happened to me, where I followed a GPS, to the wrong place, right? Like, I put in directions in my car and it told me to make the turns. And it turns out that, this does happen often if there's a glitch in the program. You, instead of trusting the street signs you're actually seeing, you know, you're relying too much on the computer to tell you where to drive to. And so I think of that in terms of the tools that we make, always rely also on your own intelligence, because it's only machine intelligence, right? And it's there to help support a decision, but it shouldn't be making those decisions. I think that's another aspect of it. And then the third is, when you're automating something, are you automating a flawed approach to begin with, right? And so, when you're thinking about, oh, it could be so much faster if we could just automate this and didn't require people to do it, and that's great. But when you're thinking about the process flow itself, rethink, are we automating the right thing? Or is this the process because it required, signing a piece of paper, and now, it's just going to go through. Well, maybe that signing of the piece of paper was needed for some reason, right? An extra check. And so how are you going to cover that? So try to automate the right things. I mean, that's just the beginning of some of the thoughts. I think there's also a new framework that NIST has put out. It's the NIST risk management framework. I think you can Google it. What's interesting about it is it covers, from a risk management framework, not just the technical robustness of the system, but the socio-technical impact and the trustworthiness of the system. And I was really surprised to see socio and trust in a NIST framework, but it's there. And you'll see some work from the FDA as well, because they're also grappling with AI-powered tools as a medical device, and they put out recently some work on that. So everything from how you're using the system to what are the potential compliance and regulatory impact of a system that does the wrong thing would be sort of the scope of my answer to your question.
And I think that that's a great way to answer it, because there's so many different use cases, so many different like nuances that Sergey might be focused on. But if you have those key principles, especially like a lot of that means stepping back and saying, what's the like when we're saying what's the process that we're automating? Is it flawed? It's saying, well, is this like is this worth putting through AI? Is it like that? Makes that gives you the potential to stop a potentially flawed process, or completely or strongly revise it before going through with like some sort of automation and making that massively available at scale.
The last thing I would add is back testing, right? But back testing for equity is what I would say. Call it. A lot of the facial recognition systems, for example, that's been in the press a lot, were trained on, the computer scientists and images from the internet and things like that. And they were not as accurate with women or people of color. And so, in that sense, it was error prone, right? If you were not, a part of the training set. And so, so before putting out, an algorithm that's going to impact, people's, health, there needs to be more rigorous testing for bias. There's a new law on the books in New York City which applies that bias audit to hiring algorithms. So if you're using that an algorithm for hiring or promotion, you're required to demonstrate that you've run a bias audit against that. And that's just the first new law that I've seen. It's just 4 months old. But there will be more that will require that kind of auditing and testing, because you would test a medicine before you put it out, right? And so this is the same idea.
So yeah, a good point too. Especially you brought up the FDA's involvement. FTC has interest in this as well. Very good point to like focus on. Hey, there's all these other organizations that are setting guidelines and like NIST guidelines and things like that. So it gives a lot of different places to go, different examples to follow when looking at these approaches. Oh, go
And
ahead.
if any of the folks on this stream are, in global companies, keep a close eye on the EU regulations. They're well ahead of us on a bunch of things, and particularly in the data privacy space. But now also they're starting to very actively regulate AI. So, when I want to look at what's ahead, I look at the EU.
Good point too. It was really was actually just recently at a conference in Chicago, the Responsible AI in Healthcare conference put on by Chicago Booth's Center for Applied Artificial AI, applied AI, and a big focus of theirs, it's same concept echoed, is that if we want to look at where the U.S. might land in this, look at the EU first, because we might not necessarily go to the extreme or the length that they're going to go, but we'll be somewhere between the wild west and where the EU lands.
Mm-hmm.
Wanted to read one that came from Daryl Schmucker, which was very, very, very much to the point we were talking about earlier. Healthcare has often talked about non-compliant patients, but isn't it more interesting to talk about barriers to care?
That's very insightful. Great question. Right. I think part of it, what an innovator's job is to turn things on their head a little bit, right? And that's a perfect question demonstrating that, and even the words we use, right, already have baked in like this sort of like, non-compliance is that already has a baked in sort of punitive kind of tone to it, right? Which is somehow you're not, doing what we told you, instead of digging into what are the barriers from you actually complying. And I agree. And I think that if you start to spin in that direction, you might actually discover things that have better, improvements in compliance, right? If you start to look at the underlying causes, and like they say in statistics, correlation is not causation, right? And so to think about things outside of the realm of that particular number, to actually identify what is the root cause and what interventions might actually increase the outcomes to better outcomes. And you can measure, right? And so, the good news is we have the tools now and the data and the compute power to actually test these out. And so, that's the power of data science and AI, is that, well, what if we did this other thing? You could run that simulation and see if the outcomes were any different, and slice and dice your data differently, and you might see different numbers that could provide for a much better output.
Now, you got me thinking a little bit too, just with the relationship with NYU McSilver, and the fact that you've been there for 8 weeks now. Congratulations.
Woohoo!
But a lot of people may have read like the first 90 days. I'm just wondering about the first 56 days here with NYU McSilver. And the reason I asked, I'm joking a little bit, but the real reason I'm asking that is a lot of people might be looking at how do I get new initiatives, or how do I even identify the right kinds of initiatives, and how do I push new initiatives forward. So could you talk about like kind of being early in this leadership position and some of the things that you're doing right now to lay a foundation down?
Thanks. That's a great question. I'm a big believer in the first 90 days. That's a book that's helped me through many inaugural position. I mean, because many of the roles that I've had were the first person in that role ever, including the AI hub, and I'm the inaugural chief AI officer. And to me, that's the most fun, because you really get to think about, what's important. I would say, from that perspective, it really does involve the sort of teleological thinking, like, where do you want to be, and then make your way there. What is the vision and your strategy, and then what are the steps that you need there? I think, typically your first 30 days are really a lot of listening and learning, and then the next 60 days is you're formulating an approach and a hypothesis, and then the last 30 days is developing a roadmap and plan. And I would say that even when I first became the CTO of New York, that was the approach, right? Understanding what were the best opportunities to have a positive impact with technology in the city of New York, working and collaborating with a lot of folks, and then putting out, within 90 days, a roadmap for getting there, and setting a goal, be named best smart city in 2 years, right? Or when I started the bank, we wanted a fully functional commercial bank with FDIC, OCC, and Federal Reserve approval in 24 months. So, and we did it. We went from $0 to raising $131 million in one summer, and all those approvals, and launched 24 months later. So it does require a little bit of optimism. And but I think, when you're starting a new initiative, to be very clear about what you really think the goals would be, and then making sure continuously that they're aligned with your collaborators and with the vision of, the enterprise that you're with.
So I've got to rewind a little bit. Definitely learning here that when you started as chief technology officer, and then getting the best smart city distinction on the planet, you started with that global aspiration.
Yes. I said that, and they were like, "No, you don't have to. Just, get these things done." And I was like, "Look, I want to put it out there, and I figure if I didn't make it, that'd be fine." But it actually happened. So yeah, that's how it happened in 24 months. So.
Well, I mean, I love that thinking, and especially just like how huge that goal is, because we can say I just want to like be performant and like get my job done, but when you set global aspirations, that's really the reason I wanted to have this conversation and just get it out there. I want to help myself and other people like just think a lot bigger about what we're capable of.
Well, there's something I tell all the folks when you're in technology, you have permission to dream big. That's it. Just dream big and do it.
Got a question actually from a fellow data scientist on our team, Matt Alhante, which is what's a good way to incorporate channels for feedback from people who are affected by AI systems decisions?
That is another great question. I think what's, one of the unique things, and I'll talk a bit about McSilver and why that answers your question, is that there have been like social research scientists working with communities, helping develop, best practices, and doing research and evaluating trials of interventions. And then on the other side, we've had, data scientists and AI folks also working with communities, but there hasn't been this triumvirate of communities, researchers, and AI scientists. And I think what's often missing is precisely what you're talking about in that question, which is to really engage and work with the communities themselves. So, and to understand their needs and listen to them when you're developing your strategy, right? And you may uncover some assumptions that would have led you down the wrong path. Your computations might have turned out okay, but the actual impact might have been counter to what you were going for, like reduced missed appointments. You might end up with just reduced appointments, right? And so is that the result you want? And I think that involving the communities directly, understanding what the underlying factors are, may help you formulate the more accurate attributes with which to apply your algorithms.
So I like the question, and I like where it's taking the conversation, because it like one thing that I mentioned, that responsible AI conference in Chicago, and one big component of that, one big outcome of that, was that it's really important for us to listen to our patients when deploying these algorithms, using the data in certain ways. It's important to be able to get that information back, and be able to engage in engage in a conversation, but also like change our approaches based on what we learn and based on what we understand. Curious, and I know new initiatives at the NYU McSilver Institute, but are there any examples that you might be able to think of where like there was an algorithm deployed, and you were able to collect some? It doesn't have to be within healthcare, but like collecting feedback from the community, listening to the community, and then making changes based on that.
Yeah, I think, I haven't been around long enough to give you a specific example at McSilver, but I did study a few of the applications of algorithms, say to child welfare, right? And I think that already that's where questions of, well, what is the ultimate result? Reducing the number of children that get taken away, or is the ultimate result, the health and safety of the children themselves, right? Or if you think about what the desired result is and get clarity on that, I think that's exactly what the algorithm would correct. I would say that where I've used it in other contexts is where we were looking at just detecting fraud in from my banking life, right? And reducing those false positives really involved understanding, well, actually, we were using a certain attribute that, when you took that attribute out, actually had better results. And so just be able to have a truly scientific mind, to interrogate not only your results, but the methods themselves. I guess if that helps at all.
Yeah, that's a tremendous help, and it kind of leads to thinking where, if we're thinking from either the AI practitioner's perspective or the healthcare leader's perspective, when it comes to interrogating these algorithms and interrogating these approaches, I think that a lot of times AI is presented as a black box, or the data never lies, and those kinds of cases. But I think that what you're suggesting, like especially like opening the AI for interrogation, that gets that opens the floor for people who might have a better understanding. Like, you might not be an AI practitioner, but if you have a better understanding about the context of patients, or the context of how healthcare operations work, then that feedback can go back to that practitioner team, and it creates a listening loop, not only for the people in the community, but for the people that have to like revise and reserve these approaches.
Exactly. I think right now the biggest concern I have is in sort of the unqualified use of algorithms, that without sort of the appropriate amount of testing, putting something out there that may have been developed, but didn't take into account, different kinds of people, or different voices, or we talked about that voice analysis. There was that analyzes how your stress level, but I don't know if that was tested on how many women was that tested on, how many people with accents, how many people who, so don't put tools out there unless they've been really, really tested with a diverse set of folks. And I might say developed by a diverse set of folks as well.
And just to give a little background, Minerva was talking about a tool that you speak into it, and it tells you how stressed it guesses you are. That was before the conversation, but first question in that was, well, is it trained to your voice, or like how was this stress estimator? And who knows if it was trained by AI or whatever algorithm. But like if it's using a universal number for like how fast my rate of speech is or what my tone is, but I as a individual just have a different pattern, then it's going to miss out on a huge portion of the population and give false positives, false negatives, and we're not going to know how stressed we are.
Right.
So we've only got a couple of minutes left, but we were talking a lot from the practitioner's perspective and the types of things that practitioners should be looking for when taking these approaches. I think there's a strong parallel between what practitioners should be looking for and what healthcare leaders and decision makers should be looking for as well. And I'm wondering if you have any thoughts as far as leaders who are evaluating these types of systems and making decisions at a large scale. Are there things that they should be looking at, or as Sergey said earlier, rules of thumb that they should be applying when making AI-based decisions?
Absolutely. And I think, as a leader, a big part of your role is risk management, which is why I think that there's sort of to think about it, not just in terms of, is something ethical, but how are you managing the risk of the system doing or not functioning as you want to, right? And as a leader, you may or may not be aware of what some of the legal liabilities may be, depending on your system. So when you're, say a tech executive, you want to look at the security of the system. Where did the data come from? Did it comply with the privacy rules in your use of it? But also to think very clearly about how you're going to mitigate the risk of the system not functioning as planned. And I'm a big believer of a human in the loop, especially when trying new things, to make sure that in addition to like the directional navigator, that you have someone with eyes and ears, as well, who can validate that the system is working as planned. I mean, we do bug testing and QA in technology all the time. We don't seem to do that necessarily when applying AI to real people and real decisions. And, health decisions are extremely important and high risk. And so I would say a good rule of thumb is to really understand, test it thoroughly, manage the risk by maybe testing with a small group first to see how well something does, pilot and prototype the heck out of it. And then also, come up with a risk mitigation strategy for it. There was when we first launched sort of this pharmacy application inside the public hospitals here in New York, there was an actual pharmacist who made sure that things were transcribed correctly, right? Because a mistake in that could have really bad impact if there was some error in the system that caused the wrong medication to be prescribed. And so when we initially tested it, we had the system do it, but we had a licensed pharmacist double check and make sure that it was correct before we went live.
Well, I think that's incredible advice, and I know we've only got 1 minute left, and I wanted to just give the opportunity. Well, first of all, I wanted to thank everybody for sticking with us and having this conversation. Mm-hmm. I thought that it just illuminated some really big ideas on how to get on how we should be thinking about our own careers and our own approaches that we're taking within our markets, be they healthcare or otherwise. But with that, Minerva, you began the session talking about what you wanted people to learn and the types of decisions that you want people to be equipped to handle as a result of this. And I think that you really summed it up, especially talking about the risk management component. Just wondering if there's any final thoughts that you think folks should have as they go about their week and think about this conversation?
Yeah, I mean, I'll quote William Gibson and say, the future is already here, but it's just not evenly distributed. So we have in this room the power to distribute the future more evenly.
Amazing. Love the quote. And were you the one who was
I was
debating
the one
about
who said, I read somewhere that William Gibson never said it, but
who William Gibson or whoever said that? Like, thank you. But anyway, thank you very much, everybody, for sticking around with us. Again, catch us on YouTube or LinkedIn Live or wherever you get podcasts, and we will see you next time. Also, just throwing out a note, we'll be at HMPS in Salt Lake City in a couple of weeks. So anybody who is coming to HMPS, feel free to come by the Actium booth, say hi.
Great. Thank you, Chris. This was a pleasure and an honor. Appreciate it.
Appreciate that, Minerva.